Good afternoon. My name is Erin Colburn. I'm the Pre-Health Advising Coordinator for the College of Health Science at Boise State University. This is one of our last programs of the semester, and we are very excited to bring to you some information about CENEU. They are a program that facilitates with learning languages like Spanish, and it's a medical immersion program. So I'm going to take it away and hand off the baton to Miss Regina. Ms. Regina, if you could share a little bit about your program and introduce your compatriots, that would be awesome.
Absolutely, thank you. So I am here with my colleagues, Paola Gutierrez and Dr. Cesar Aranguri. So Dr. Cesar actually graduated from medical school at our partner university in Mexico. So they'll both be helping share more about the hybrid medical immersion program today. So I'm going to go ahead and share my screen. Do you guys, Paola and Cesar, would you like to introduce yourselves?
Sure, I'll go first. So as Regina said, my name is Cesar Aranguri. I graduated from University of California, Irvine, doing my bachelor's in biological sciences. From there, I worked at the University of Southern California, the Trojans, in research investigation for a couple of years before I decided to go back to school for medical school, where I went to Universidad Xochicalco campus Ensenada over in Mexico. And I'm glad to say I came back, and right now I'm actually starting a residency in California at Kern Medical Center in internal medicine this July. So, I'm just really happy to be back in the United States.
Thank you so much, Dr. Cesar and Paola.
Hi, I'm having technical problems. I'm sorry, guys. My name is Paola Gutierrez, and I'm so happy to be here. Erin, thank you very much for putting this together. We love this program. I'm part of the management team, and personally, I'm just in love with what we have done. So I totally, we're so excited to share our experience and what could you get out of it. If it's in this program or in any program related, just we encourage you guys to not only study your curriculum, but do all these extracurricular activities that will honestly help you out to become a better health provider.
Awesome. So I'm going to go ahead and share my screen. If you guys could let me know if you can see it. All right, so can you see my screen?
We can.
Perfect. So thanks again for being here today. Hola a todos, bienvenidos a nuestra sesión informativa del programa de inmersión de español médico el día de hoy. So I wanted to hear a little bit about you guys first. So I know we heard about some of the students, the tracks that they're interested in. I'm hoping to hear a little bit more about your Spanish backgrounds. Do any of you have a prior Spanish background?
And Regina, I apologize. I forgot to bring Chase Crandall into the mix. He's pre-med. So maybe he could start if he wanted to share maybe what his Spanish background might be.
Yeah, so I am a pre-med student, like you said, and I'm doing a minor in Spanish. And so I just finished that up, and I've been doing some medical interpreting at the Genesis Free Clinic. So I'm looking forward to learning more about this program to kind of like continue furthering my Spanish skills.
That is awesome to hear. And for Cameron and Cassie, do you guys have prior Spanish?
Yeah, so I took like 4 years of Spanish in high school and took upper level Spanish for a really long time, and haven't really done much with it in college just because I've been so busy with, I'm also in the honors college program here and in a bunch of other activities, but I definitely understand the value and the importance of learning another language and being able to speak another language within the medical realm. It's just such a huge skill to have. So anything to learn more about language and immersion programs is kind of piqued my interest for sure.
And Cameron?
So I'm actually taking Spanish right now. I'm going to finish up Spanish 302 and then go to 304 in the fall. I'm trying to get my minor in Spanish. So I hope to keep continuing with that and just keep using it, especially in the healthcare field that I'm going into.
That's so awesome to hear. So our program is geared towards all levels. So no matter whether you have taken, just Spanish in high school and you feel rusty, or you're minoring it or double majoring it, you're going to be challenged no matter what. So we are going to be talking a lot today about the language barriers that Spanish speakers with limited English proficiency face when they go to the doctor here in the US. So since we want you guys to be able to visualize and really empathize with the situation, we are going to place you in their shoes through an exercise. So Paula will begin this exercise, and it's totally fine if you only catch a few words at this point.
Vamos viendo cómo está el español. Imagínense que están en México para el cumpleaños de su mejor amiga. Hace mucho calor. Está precioso el escenario. Es en Xcaret, en Cancún específicamente. Están viendo las pirámides. De regreso a su hotel, se encuentran en un choque de automóvil. Van manejando y ¡pum! ¡Ah! De repente se escucha la ambulancia. La ambulancia viene por ustedes. Lo primero que les dice el paramédico es, ¿qué pasó? ¿Dónde te duele? Y lo único que pueden decir ustedes es, ayuda, help, help.
Muchas gracias, Paola. Okay, so who understood the story? What did you understand if you did?
Sounds like you were in a car crash in Cancun.
You heard the ambulance coming. That's kind of like the last thing you remember. That's what you said. You kind of just like don't really, you remember bits and pieces of the crash, but mainly just the sound of the ambulance.
Awesome, thank you guys. So we're gonna try it again in English just for anybody who didn't fully catch that. So imagine that you're celebrating your best friend's birthday in the Yucatan in Mexico. You're in Xcaret looking at the ancient pyramids, having an amazing time, taking in all the sights, smells, and sounds of this land. On the way back to the hotel, you glance out the window and see another car running a red light heading straight to you. The shock is immediate. You open your eyes and the next thing you know, you hear the ambulance blaring and the paramedics headed straight to you asking, ¿Cómo estás? ¿Dónde te duele? Are you okay? Where does it hurt? And all you know how to say is, ayuda, help. So this is how many limited English proficient folks in the US feel when they become sick or develop health issues. Whether it's an injury resulting from an accident or a contagious disease like COVID, we can only imagine how scary it would be to face for someone who doesn't fully speak the dominant language where they are. So let's dive in and learn a little bit more about the Hispanic population in the US and just how many folks are affected. So as you're probably aware, sorry about that, there is an enormous Hispanic population in the US right now, and it's only growing. Can you guys see the chart here?
Yes, we can see it.
Okay, perfect. So right now, if you look at 2020, almost 20% of the entire country is Hispanic. That's almost 1 out of 5 Americans are Hispanic. And the statistic is projected to only trend upward in the next years and decades. So where you guys are in Idaho, the percentage is a little bit less. I believe it's 13%, but it is also rapidly growing. A report from the Idaho Commission on Hispanic Affairs found that Latinos accounted for 24% of Idaho's population growth over the last decade. So this population in Idaho is also expected to keep growing. So of course, many of these folks are bilingual, or at least somewhere in the middle where they can communicate in basic English, but an entire 30% self-identified on the 2017 census that they don't consider themselves fluent in English. So they wouldn't be able to communicate effectively with a doctor who only speaks English. So you know that a high degree of accuracy is needed to establish a correct diagnosis and treatment plan. So when a patient can't really describe their symptoms fully, a lot is falling through the cracks and the quality of healthcare is suffering. Just think back to our imaginary car crash scenario in Xcaret and think about how much miscommunication could occur between you and the medical paramedics in Mexico if you don't feel super solid with your Spanish. So to recap, millions of people in the US are scared to go to the doctor because of this language barrier, on top of potential fears due to immigration status and lack of familiarity with the healthcare system in the US. And unfortunately, this has really shown itself to be the case during the COVID-19 pandemic. So according to the CDC, Latinos across the country were twice as likely to contract COVID-19 as their white counterparts, 2.8 times as likely to be hospitalized, and 2.3 times as likely to die. So this is a huge discrepancy, and the numbers are really haunting. The saddest part is that this is just evidence based on one illness and its impact in the last couple of years. With diseases such as diabetes and cancer that have been around for centuries, it really makes you wonder how much of an impact miscommunication has had this whole time. So zooming back into Idaho, we can see, according to the Idaho Statesman, that COVID-19 was the top cause of death for Hispanics and Latinos in Idaho in 2020. And that spread through Hispanic and Latino communities came amid large outbreaks at food processing and meatpacking plants in rural areas. Plus, there was limited Spanish language outreach efforts about the virus. So as we all know, prevention measures have been key in protecting us from COVID-19. And this information just was not as widely shared with Spanish-speaking communities to the extent that it could have, making us wonder how many human lives could have been saved with outreach efforts geared towards Spanish speakers in culturally appropriate ways. Okay, so as you can see, there's a huge gap to bridge between the limited English proficient Latino population and the majority Anglophone healthcare providers and system. So we at CENEU began to ask ourselves how we could begin to close this gap in access and ensure health equity for all. Because we saw that the Latino health is unfortunately shaped by language and cultural barriers, lack of access to preventative care, as well as health insurance, we decided to develop our medical Spanish immersion program that allows future healthcare providers to provide adequate care for this population. So that's where we come in. Our goal is to train future health professionals to be able to meet the needs of the growing Latino population by offering medical Spanish training within a complete and comprehensive cultural context. So I want you to close your eyes again. We're going to do another imaginative exercise. So we're back in Mexico, in beautiful Ensenada, Baja California, about 2.5 hours south of San Diego, where the in-person part of our program is located. Take a moment to breathe in the smell of the fish taco stands and the sight of the endless ocean. You've just completed the virtual component of our program, and you're practicing your medical Spanish with your Mexican peer mentor, who is also a medical student, but in Mexico. You're conversing confidently in Spanish about what the medical field looks like in both of your countries, how it differs on either side of the border, but also how much is shared. You're reflecting on how much you've learned not only about the medical field and medical terminology in Spanish, but also about the culture that your future Spanish-speaking patients are coming from. So even though COVID hit and our program had to go viral, we've still been able to make it fun and engaging. Our program is fully immersive, and that includes the cultural aspects. So in between your medical Spanish lessons and conversational practice, you'll be participating in fun cultural activities since we want you to really feel like you're in Mexico. So we have like cooking demos where you'll be guided by Mexican chefs and making ceviche or guacamole or another traditional Mexican meal. We have dance workshops where you'll learn to dance to mariachi songs. You'll meet local families that will open their doors to you and virtually share a meal with them. And all the students that you'll meet are in med school in Mexico currently. So they're all in the 18 to 25 year age range, just like you. So you'll be able to share mutual experiences. So I want to show you a little video of these cultural components. So if you could let me know if you can see the video. Are you able to see the YouTube video?
Yeah.
Awesome. so that was one of our dance lessons to El Mariachi Loco song. So it's just fun to break up the medical Spanish lessons and add these cultural aspects. And we believe that culture is really essential in order to understand the language as well. Okay, so can you see my PowerPoint again?
Yes.
Okay, great. Okay, so now to the backbone of the program. Our three main components are gaining field experience in underserved communities by shadow doctors, learning medical Spanish as well as the colloquialism or slang terms that your patients are more likely to use, as well as collaborating with Mexican medical students. So it's called the hybrid program because it starts with 2 virtual weeks and then ends with an in-person week. All of our virtual classes are live and synchronous in real time. They're not pre-recorded, so you can always ask questions if you don't understand. You basically just practice a ton in a friendly environment where it's totally fine to make mistakes. We all understand that no matter where you are with your Spanish, whether you're beginner, intermediate, or advanced, to even a native speaker, we're all here to grow and learn, and making mistakes is part of that. So basically you'll be hearing, speaking Spanish all day long, and you'll be receiving feedback in order to improve your Spanish in real time. So a really cool aspect of the virtual program is that we have folks from our team transcribing all the conversations, and they're analyzing the recurring mistakes that you might be making when you're speaking Spanish, and they're sending this feedback to you with gentle but helpful suggestions for how to correct those mistakes. So that's probably something that wouldn't be happening in person, but really helps you virtually. Our students are always commenting on the professors and peer mentors' patience and flexibility. You really feel that everyone's here to help you grow. It's fully immersive. We encourage everyone to stay within Spanish during the program, but we do have bilingual moderators present to clear up any doubts or confusion that might arise. So it's super intensive. Your level of Spanish will truly skyrocket over these couple of weeks. And our hope is that you'll even be dreaming in Spanish by the time the program is over. And so I'm really excited to show you the progress with Nico. Nico is actually a Boise State student. So do any of you actually know Nico by chance?
You probably don't. He was in our online degree program.
Okay, I see.
But he did the PA prerequisites, and he's going to Idaho State University's PA program in the fall. He graduated last summer.
So I like to show this video because this way students can see that even if they do come in like intermediate low or beginner, that they will see huge improvements. So can you guys see the video?
Yes, we can.
Great.
Ahora yo trabajo en la hospital por la COVID-19 y voy a estudiar en Universidad de Me voy a aplicar por la Universidad de México. Sí, en Estados Unidos tenemos universidad por 4 años para bachelors y después diferentes ocupaciones. Me encanta mucho y platicar con mis mentores y doctores y maestros. Me encanta mucho.
All right, so what did you guys think of Nico's Spanish growth, just from what we saw? Any comments?
That's insane. Like I took Spanish in like high school for 4 years, and like I definitely do remember a lot of it, and a lot of it's still rusty, but just seeing like the pauses and the breaks in his speaking, and then just being able to, he just sounds so much more like fluid with the way he talks. And yeah, just over 3 week time period. That's crazy.
Exactly. Yeah, that's always the reaction that we get.
Regina, that was only 2 weeks, Cassidy.
Yeah,
Because
because
they didn't do the third week.
Sign me up.
Last year.
week. So yeah, but really when you think about it, I mean, it's like the full week. You're there from about 9 to 6 p.m. I mean, obviously you get breaks in between and you get a long lunch break and everything. But it's all day long, Monday through Friday, both weeks. So you're just surrounded like on all sides. All right, so now Dr. Cesar will share a little bit more about what the first week looks like.
Great. Thank you, Regina. So for those who didn't get to be here in the very beginning, my name is Dr. Cesar Ongari. I'm a graduate of the Universidad de Xochicalco campus Ensenada, and I'm currently about to start a residency in Kern Medical Center in California in internal medicine. I want to talk to you guys a little bit about the hybrid medical Spanish immersion program. During the first week, the first 2 weeks are virtual, with the third week being in person. And the first 2 weeks, in the first week, we focus on the doctor-patient relationship unit. And it's during this week where you're gonna practice your basic Spanish expressions, how to establish a rapport with patients. We go over not only formal medical Spanish, but a lot of the regional or colloquial Spanish terms that you may not get to hear about in your regular Spanish classes. For example, a patient can come in and say like, me duele la barriga, or me duele la panza. Barriga and panza are other words for estomago or stomach, and that's generally the one that's mostly used in the United States, estomago, because that's the formal one. But there's hundreds of examples of different words that patients will use. And part of the immersion cultural program that we want to do here is so that you learn a lot of those so you can better understand and communicate with your future patients in your field. You also learn how to interview patients to take their medical history, learn about their daily activities. And as I said before, it's a complete cultural immersion. So if we go to the next slide, we'll see a sample of the schedule. I won't go over the entire thing, but basically it's broken down to linguistic structure classes to help you improve your Spanish, medical terminology and colloquial classes, so you can learn so you can better improve your medical Spanish. And also we finish off with some fun cultural events where you get to learn more about the culture in Mexico. This first week, as you can see, is jam-packed. It's very intense, so that you are basically immersed the entire time in Spanish, with our goal being that by the end of the program, you're dreaming in Spanish, basically. If we go to the next slide, during the second week, we focus on the patient's conditions unit. And this is where we take the basics that we learned from the first week and then start applying more towards medicine and anatomy, biological systems, patient conditions, in order to help improve your communication skills. We also include shadowing doctors through telemedicine as they rotate in the Valle de Guadalupe, which is a underserved community that's close to Ensenada, about 20 minutes away. If we go to the next slide, you can see another sample schedule of the second week, which is also a virtual week. And as you can see, it's just as jam-packed, if not more than the first week. And this is part of the reason that we saw such great improvements with our students in the past, in that when you are immersing yourself all day in speaking Spanish, listening to Spanish, and reading Spanish, it really helps to bring that out. One of the things that I didn't mention through both of those is that we have a lot of speaking exercises. So these classes aren't just passively listening like a lecture in class. It's a lot of participation, and we have live moderators that will translate everything that's said in Spanish into English, so that you're not only listening to it, but you're also reading it and practicing it, which is the closest you can get to almost living there. And which brings us to our third week. If we go to the next slide. The third week is the in-person week, and that's basically the culmination of the entire first 2 weeks of boot camp in Spanish that you did, so that you can apply it, apply all that theory into a practical skill. And during this week, you would go to Mexico, to the city of Ensenada, which is actually where I lived for the 6 years that I was in medical school down there. It's a fantastic city, amazing food, amazing people, very beautiful. And you'll get to stay with the host families. A host family is actually one that you will meet during your first 2 weeks in the virtual. You'll be sharing meals with them, usually during the lunch or dinner time, where you can converse with them for about an hour to an hour while you guys get to eat, get to know each other. And then in the third week, you'll get to go visit them. You'll also get to visit a lot of the faculty that you got to meet, and a lot of the peer mentors or other medical students that will be practicing with you during the first 2 weeks. So yeah, definitely a combination of everything and getting to meet everybody that you've been talking to for the first 2 weeks. We go to the next one. Yeah, and this entire program is done in collaboration with the Department of Medicine of the Universidad Xochicalco campus, which is my alma mater. And this makes it a huge difference from other programs that wish to help you speak Spanish, in that, yeah, it's collaborated completely. So therefore, all the docentes, or you guys might know them as maestros. Docentes is another word that I personally didn't know until I went down there and found that docentes is very commonly used for a teacher. But you'll get to meet all of it, and they're all medical faculty or doctors or medical students at this university. So yeah, I can talk about Xochicalco and Ensenada for hours, but here's a video instead to help you guys see what the campus and what student life is like.
Years, Universidad Xochicalco has earned a reputation of excellence in Mexico's Northwest region through our 3 campuses in Ensenada, Tijuana, and Mexicali.
On each campus, we hold traditional and bilingual high schools, 14 bachelor's degree programs, 18 master's degrees, a PhD in education, and medical school.
Hi, my name is Grace Centeno. I'm 31 years old and I'm a medical student here at the University of Xochicalco, Ensenada in Mexico. All I can say is very rewarding and challenging at times. They already start you out with doing patient care out in the community starting in first semester. I found that very exciting and challenging at the same time. And if you're thinking that, oh, wow, it's in Mexico, I don't think I can do it because my Spanish is not that great, don't let that stop you from coming here, because I also had the same mentality. I didn't think I was going to be able to do it. It is a challenge, but the good thing about here at the university is that the professors here are always willing to help you out in understanding materials. They're willing to take their extra time. And also my fellow classmates, they help me with certain things that I couldn't understand or translate. And everyone here is so helpful. They provide programs, they offer tutoring services. So don't think that you can't do it or that you can't come here because of a language barrier. It is doable.
Over the past 45
All right, so as you can see here, once you finish the course, if you do, whether you do 1 or weeks, you will be eligible for this certificate of achievement upon completion, which will be stamped by both the medical school, Universidad Xochicalco, and the language school, CENEU. Do you have any questions about this so far? All right, so just to recap our whole program. If you do this program, what will you gain? Okay, so the most important thing, you'll learn how to communicate with your future Spanish-speaking patients effectively and with empathy. And you'll also learn to, you'll be able to network and develop relationships with the faculty and MDs, which means that you'll have an opportunity to receive letters of recommendation from these doctors, as long as you're, of course, actively participating in the program and demonstrating your passion for greater equity in healthcare. And in doing this, you are promoting access to basic health measures for our Spanish-speaking communities so that these communities are better equipped to survive global pandemics and more preventable illnesses. Do you guys know about the 15 core competencies for applications to med school?
I do not.
Okay, so once you apply to med school, you will be asked to demonstrate that you've developed these 15 competencies. So we actually focus on 7 of them. So we focus on oral communication, of course, through medical and colloquial Spanish, cultural competence and teamwork through your collaboration with Mexican medical students and just gaining a different perspective and international perspective on your coursework. service orientation and social skills as you're shadowing doctors and working in the communities, and resilience and adaptability by just being able to study abroad virtually during a pandemic, which is pretty cool. So I want to share some of our success cases that have completed our program. So we have Adriana Brancaccio here on the left from UCSD, who was accepted into her Dream PA program. And part of that, we do believe had to do with the letters of recommendation that she received from the doctors in our program, since she was such a standout student throughout the whole program. In the middle here, we have Daniel Sai from UC Riverside, who is now leading pláticas, or conversations about COVID safety and preventative measures in his local Latino communities, all in Spanish. And he's able to get through these encounters and not feel like there's any miscommunication, which is pretty amazing. And then on the right, we have Percelda from UC Riverside. So she's actually publishing a cookbook for Latino preventative measures with the guidance of the nutrition department at Universidad Xochicalco. The faculty helped her present her research in Spanish, and one of the panelists who heard her presentation was so impressed with her research that they put her in contact with another doctor doing research on a similar topic. So as you can see, this program really opens you up to opportunities on collaboration, whether with research or service projects internationally. Okay. So I think heard enough from us, but I wanted you to hear from some participants themselves. So here are some testimonials from participants from our last year's program.
Thank you so much to CENEU for choosing the University of Xochicalco for our immersion program. They are an incredible institution with really amazing people to learn from, and I'm really glad I was able to be a part of this experience.
I believe it was a terrific opportunity to be partnered with you guys as part of UCR School of Medicine, because we learned a lot about the health disparities in Spanish terms. And I believe that's really important in helping a community in Riverside where a lot of patients can only speak Spanish.
All the students were so helpful. They were eager to help us learn. The professors were very professional, very nice. They were caring, and they were always patient with us. I mean, they did a great job, even with all the cultural events, despite everything being online. We felt connected. We felt connected with the students, with the campus. I'm just so happy that we were able to have this experience, and it was incredible despite it being all through a screen.
Okay, and I also wanted to share with you a window into our community clinic in Xochicalco. So obviously this is not public on our YouTube channel because of HIPAA, but we do have permission from the patients to share it with you guys during the info sessions.
Acá tenemos otra intervención de la doctora con otra usuaria del servicio. Señora, estamos transmitiendo en un curso para alumnos de la Universidad de California en San Diego. Entonces les estamos mostrando qué es lo que hacemos nosotros aquí en las comunidades. Si quiere usted que no quiere salir su carita, pues usted queda volteadita, ¿verdad? No hay problema. La doctora está haciendo una detección de crónicos. Vamos a escuchar las preguntas.
Gracias. Caminar. ¿Cuánto tiempo camina al día?
Vamos a la colonia, vamos los sábados y ahí ponemos carpas, mesas, sillas y llevamos así todos nuestros senderos como ahorita y las personas se acercan. Tratamos de ponernos en un lugar donde haya frente, como esa vez estaba un tianguis. Se pone un tianguis ahí, que está en el parque, ¿verdad? Y tratamos de ponernos donde vemos que hay gente.
¿Se pone energía durante el día?
Sí.
Do you guys have questions about the shadowing part of the program?
Yeah, so I have a question. I'm kind of just talking to it's Caesar, right? Yeah, okay.
Yes.
So you kind of mentioned how the program is going to be virtual, and then like you also mentioned how or it's going to be like in person for the last week of it. Is that still the plan, or I don't know, what is your guys, I guess that's just kind of like what's your plan that you guys have planned now of like, oh, we're going to learn for 2 weeks online and then go down there, yeah, kind of thing. That's just kind of what the logistics is what I'm curious about.
So perhaps the question is are you able to travel this year to Mexico, or would it be the next year that you guys are going to do the in-person week?
Paula, do you want to take this one?
Yeah, thank you for your question. Actually, we're eager to be able to bring students to Mexico. Unfortunately, we can still, but we're expecting to have the third week either in fall, like the worst case scenario would be the next summer. But still, in order to do the third week, you guys still have to do the first 2 virtual ones. Just because what you saw on the video with Nico, it's because it's like a 30-hour week program where every class is divided in 2. First, the professor, as Cesar mentioned, and the other half, it's only conversational. Like you do breakdown rooms with other peers that they are studying more or less similar things than you. You will see some differences. People that are like students that are graduating when they are, Cesar, help me on this one, 23, right? 24?
Yes, in Mexico, because they go out from high school into medical school, it's 6 years program. So they're generally like around 20 to 24, the peer mentors that we have, 19 to 24.
Yeah, so
wait, sorry. In Mexico, as soon as you graduate from high school, you go right into medical school?
Yeah, in Mexico, it's
Wow.
there's no undergraduate. It does result in a lot of big differences. Like, for example, in the US, medical school graduation rate is very high because you guys had such a high bar to get into it. In
Yeah.
Mexico, because a lot of people come out of high school and at the end of the day, they may not want to do medicine after all, but that's what they think they want to do. It's a lot lower of a graduation rate. But the end result is, they get to be full-fledged doctors by the time they're 24, completely graduated with a license to practice much quicker than in the US.
Yeah, no, I definitely, yeah, wow.
Yeah, and actually, Casey, that's like one of the small examples, or not small, but once you talk to your peers, then you start learning a lot of differences, like how like education works and how like a patient work, and that's the most exciting part. So back to your question, that's why it's very important to do the first 2 weeks virtual, because not just because you're going to be practicing all the time, but also because we can correct. And then on your third week, actually you will go and meet your friends because you have been talking for the past 2 weeks, right?
Yeah, no, I love that. That's great.
Yeah, and then afterwards, and if you're lucky, then you can choose to stay as a host family with them. I mean, it depends if they are certified to accept a student, but that's our main goal. Our main goal is not just to show you the language, is that you actually are immersed with the culture. So in the near future, when you receive a patient, if you don't know exactly all the words in Spanish, you can break the ice, and that's the most important part for the patient to be able to express themselves and be confident to express their symptoms with you. So that's our main objective. Mm-hmm.
Other questions? How would they get a hold of you to start this process of possibly doing something like this summer?
That's a great question, Erin. So you can definitely contact me at regina@ceneu.com, or you can always shoot me a text or call at 619-455-9986. And I'm going to go ahead and show you on the CENEU website, if you are interested and you already know you want to save your spot, how you would go ahead and register. Can you guys see my screen?
Yes.
Okay, great. So this is the CENEU website. It's just ceneu.com. So if you go down to programs, so we have a crash course also, which is kind of like a shortened version. If you click on the hybrid medical Spanish course, which is the 2-week one, the immersive one for the summer, we'll be able to just go ahead and scroll down. Oh, it's just taking a moment. Okay, so you could just click on this link will actually take you straight to that form. But if you go all the way down here, you can provide your name, your email, your phone number, which virtual weeks you're interested in, if just one or both, your level of Spanish. And then once you do that, you'll be able to register. And you can pay right on the website if you want. And here, I'll go back to the slides so I can show you our payment plans. Okay, so initially the program is $800 for each week, but we are giving you guys a scholarship if you're willing to give up just 4 hours of your time to help the Mexican peer mentors practice their English. Then we'll actually give off a whole $100 of the program. So it is between 30 and 35 hours, just depending on how many cultural activities we do each week. But like I said, the whole week long, pretty much all day long, Monday to Friday. That includes your welcome kit, the workbook, course materials, your certificate at the end. You got a glossary for common words and phrases in Spanish. Of course, as well as your courses and the language practice the shadowing, and the networking with the medical school students. So what's nice about it too is that you can do a payment plan if you don't want to pay, if you're just doing the 1 week, the $700 up front, or both weeks. So let's see, I think we go back to the website, we can see it is, if you want to do the scholarship, it's just $140 monthly for 5 months if you do 1 week, but we highly recommend doing both weeks because by the time you finish the first week, you're kind of just like hitting the ground running with your Spanish. So that would be just $280 per month for 5 months. And obviously, we also encourage you to reach out at your campus and see if there's other scholarships that are offered at your school that might be able to fund this program for you. We've had a lot of students do that in the past, but we definitely don't want cost to be a reason why you don't sign up for this. So definitely reach out to me if you want to do the program, but you're not sure how to afford it.
And then is the cost of coming down there for a week in person also, where can we find that information?
Yes, so I believe it's $900 for the in-person week. Again, we don't have the dates for the in-person week just yet, but for the $900, that includes your homestay. It includes 2 meals per day, as well as your classes, the practice, and the shadowing for that whole week. So you just have to book your flight from Boise to San Diego, and then we pick you up at the border and take you down to Ensenada.
Okay, cool.
So Cassie, basically I'm pretty sure Paola's not loving that it's probably not going to be this year. It's probably not going to be in person this year. It's likely more going to be next year. So you could do the two weeks and get the experience. And that's what Nico did. And now he's furthering his experience. When he does the PA program at ASU, he's doing the Latinx track. So he's doing a Spanish track for that PA program. And so, where you're thinking about dental school next spring, right? And also I imagine, Paola, if you were thinking about like, well, gosh, maybe Cassie, we could do the summer program this summer and then hiccup with the in-person before she takes her DAT next summer, right? She
yeah, actually,
I'm looking do the week later.
But I mean, definitely, because I will I'll be applying to school, and I won't be starting dental school until like, hopefully, if I get in, that's the big hope, is
You will. You
fall
have
of
to start with that. You will get in.
yeah, no, I will. There's
Yeah.
well, there's no plan B, so I better get in. It'll be fall of 2024, so I still don't really have plans for that year. I've been actually looking at other I'm looking at studying abroad in Italy and doing a public health internship over in Italy for that year. But honestly, if I could look into other programs, and this program seems insane and amazing. And yeah, because I wanted to study abroad my sophomore year of college. I planned on studying abroad for that whole year, but obviously that was during 2020. And I had the plane ticket booked out. I had the school, the location, everything. And then I got a call that June, and they're like, yeah, no, you can't go. So I kind of see that year between me applying to dental school and between my graduation as kind of my year to study abroad and figure out what I want to do, and potentially do a grad program or something like that, or something like this. So even that is amazing opportunity for sure.
I think, as Erin was saying, yeah, of course, like, we honestly, it's so cool, like both experiences. I mean, and that's why we decided not to like put it as a prerequisite, the virtual one, because it's so cool what you get out of it, and it's a totally different experience. Of course, once you go to Mexico, of course, it's going to be part of, like you make your own experience, right? Like it's more about the conversation that you have, and it's like more informal. But here it's more aligned to, like the med part, the like med terms. My suggestion, Casey, is if it allows you to do it now. Do these 2 virtual weeks now, because we don't know. And actually, that's another question for you, Erin. If we're allowed to do the like in person in fall, what would be the dates more or less that would suit the students? Because perhaps we can, once we get
thing I can think of would be the week of Thanksgiving.
Okay.
That week our campus is closed for that entire week.
Mhm.
Other than that, it would have to be probably December, like the week after finals, which are fall finals. See, so it'd have to be like the week of the 19th through the 23rd before Christmas, so
Yeah.
because we are going back as live as we possibly can. Before COVID, we were 80-20, so we were 80% in person and 20% online. So that is our hope for the fall, is to be back in that kind of a structure, especially for those science classes. There are students who are doing everything pretty much online. And, for someone like Cassie, it might work out that she could do both, right? Like she could take that week, whatever it was. But those weeks are the ones that we know we would be closed.
Because in January, when do you start?
We don't start back up until it's probably going to be, so we go right back pretty quick. So January 2nd through the 6th would be when we would not be in session. We'd probably be back in session back on the 9th.
Okay.
It gives us more summer when we do that. So we get more of a summer semester for our students, but yeah. So I would say Thanksgiving week, the week after our finals, and that week in January. We also, have the week after Christmas that our campus is closed, and so students are not in session. That's another good time too. So, but it would be individualized by student.
Oh, okay. Okay, got it. Got it. Yeah. So what has happened is that even though we're not authorized right now to do it, what has happened is during the virtual programs that we have done, students have become friends, and they have like, you know, they have a range to meet each other. Some of them, of course, because they were in California, so it was like easy to just drive there. But I think now like the world is like weird on what can be done and what cannot. And I think what we have learned about the pandemic is don't postpone it. And if you can add on any experience, do it. That's my main advice. Now, the program, even though it's virtual, it has like around 34 people behind it. Like it's easier to do it, you know, in person than actually do it virtual, because since everything is live and everything is, you know, from we have faculty, we have students, we have peers, and the only way to learn another language is actually to practice. And I will be very honest, this program will not teach you the best grammar, you know. We have the teachers that you will, you know, like they will teach you, but what you will learn is how to talk and how to understand your patient and cultural differences. If you want to learn 100% all the grammatical rules, I will be honest, this is not the program. If you want to learn how to communicate and learn about your peers and around the health, within health providers, then this is a program.
I think that's a really interesting point, because like throughout my formal education of Spanish speaking, I can understand a lot more Spanish than I can speak it, just because I'm a perfectionist, and going through school, you kind of learn that if you can't formulate a thought in the right way, then maybe don't say it type thing. So getting through that barrier of, okay, it's fine if my grammar isn't perfect, but somebody can understand what I'm saying, is such a more valuable skill, because even when I meet people that English is not their primary language and they still speak to me, I can understand them, even if they miss a the or a, you know, use past tense when they're not supposed to use past tense type thing. It's like, I still know exactly what you're saying, you know.
All right, any lasting questions?
Yeah, I do have a question. I saw on just on the cost thing, there said like there was a scholarship on there about like a English of like 4-hour English conversation. What was that supposedly about?
Yeah, so for each week, if you are able to donate 4 hours of your time so that your Mexican medical student counterparts can actually practice their English, then you will pay just $700 per virtual week rather than $800.
Okay, and this is 700 per week with that. Okay, thank you.
Sure.
I think one of the biggest challenges is that you have to consider that it's a full-time week, you know, because even though that you can see the sessions are pre-recorded, it's not going to, if you're not like exactly on the time, you will not be able to practice, because you will be assigned a mentor just to practice with you. I mean, and practice is saying to have a conversation, right? So that's the biggest challenge, right? The time, I think.
All right, I'm going to stop our recording.